my name is Shannon Duffany, and I am the early oncology planning lead for clinical trials in oncology at Sanofi. I support the design of clinical trial strategy and execution in various regions across the world, meaning I work with teams to set up trials in their respective countries. And these teams work with physicians and hospitals for the recruitment of patients on investigational studies. I've been in clinical research for better part of about 20 years, working across various therapeutic areas and different trial phases. So the drive behind what I do every day is really because I've always held a passion for drug development process and supporting the advancement of treatment options. To me, clinical trials have always meant bringing more hope to more patients. And my true drive is to make an impact on cancer patients' lives. I do have a personal connection, as sadly most of us do, to oncology and to clinical research in oncology. Recently, I found a more personal passion for clinical trials, now playing the role of daughter of a cancer patient and subsequently his patient advocate. And given my father's disease status, enrolling him in a clinical trial was really the best option. Sitting on this side of the table has provided a new perspective on my daily work. This opportunity to be a patient advocate for my dad, albeit not one I'm happy to have, but one I'm grateful to be able to support, has truly reignited my passion for patient-centered drug development. I believe patients need to be at the heart of our clinical trial designs. And as we think about the development of a new trial, we need to regularly ask ourselves, this side of the table, how can we make participating in a trial easier for a patient? How can we do a better job educating patients about clinical trial options? What does it mean to be part of a trial? What am I truly signing up for if I do join a trial? This is what I mean when I say patient-centered drug development. This is the true aim of clinical trials, finding new ways to treat diseases, finding better ways to treat diseases. When we begin trying new drugs in humans, we take a very conservative approach. For instance, we start at very low doses of the investigational product and only test in a small sample of people. Here is where we look for any potential safety concerns. In fact, we don't evaluate efficacy or how well the drug works until much later in the process. And I'm sure you're thinking, yeah, okay, but what about the risk? And I'll tell you, of course there's risk, but honestly, there's always risk with anything we put into our bodies, even for medicines that are already approved for human use. Additionally, joining a clinical trial doesn't mean you're taking on all risk and no benefit. There may be treatment approved for your condition, but it doesn't mean it's the right treatment option for you. There's also situations when an approved treatment may no longer work for patients, or if the disease progresses, meaning the disease gets worse, clinical trials are needed to find these new answers. When entering a clinical trial, you could have less side effects than what's available for regular treatment right now. There's also a chance that investigational drug works better than what's currently available. This is what we mean when we talk about risk to benefit ratio. You have to ask yourself these questions, right? Is there a benefit to trying this new drug that outweighs the risk of not trying it? Participating in a clinical trial may actually get you tomorrow's treatment today.